everybody, this is Dr. Ziv Simon, and in this video I'm going to talk about the medication formula to control your patient's pain after an extraction. So we're going to dive into a topic that makes patients a bit anxious, tooth extraction. So it's right up there with having a root canal, but I'm going to share some wisdom specifically about managing pain during and after the procedure. You know, one of the main reasons patients dread extractions is the fear of pain. Pain during the procedure and that lingering discomfort afterwards. Let's start with managing pain during the procedure. The secret sauce here is mastering local anesthesia, a profound block, a vestibular infiltration, a lingual and palatal infiltration, deep, profound. The patient is going to feel nothing. So don't rush it. That block needs time, often 15, 20 minutes, as long as it takes. We all miss blocks, so we don't want to get started before the patient is fully numb. And the patient is going to be very thankful for that. I still see doctors rushing that local anesthesia. That's probably one of the most important things before you're doing an extraction. Profound anesthesia, long-lasting anesthesia during the procedure, somewhat after that. I often give local anesthesia, specifically Marcaine, right when I'm done with some infiltration. I want my patients to be numb for a few hours after the extraction so the anti-inflammatory medications can kick in. Now, post-extraction pain, that's where it gets interesting. Clear instructions are the name of the game. But before I unveil the magic formula, I want to give you a quick reminder, and it applies only to patients that can handle these medications. I'm going to share the exact medications that I'm using, but make sure that it applies to your patients. Check their tolerances, their allergies, their medical conditions to make sure that what I'm recommending applies to them. Okay, we still have to review that. I'm giving you what I'm using for most patients as long as there's no medical contraindication. So here's my pain control formula. 600 milligrams of ibuprofen plus 1,000 milligrams of acetaminophen every 6 hours. So ibuprofen is the generic. You can use Motrin, Advil. Acetaminophen, 500 milligrams is extra strength Tylenol as an example. That formula works really well post-extraction. They'll take it right after the procedure. They'll take it 6 hours later and then 6 hours later, and also keep that regimen next to their bedside, because if they wake up in the middle of the night with pain, they got it right there and then and they can take it. If the pain is more severe and it still lingers, you can try a modification of that formula. So we'll still go with the 600 milligrams of ibuprofen. We'll add, this time, 500 milligrams of acetaminophen, and we'll add a narcotic, a Percocet 10-325. So the 325 stands for acetaminophen because it's inside the narcotic, and the 10 milligrams is the narcotic medication inside Percocet. Now, it's a very delicate balance to avoid exceeding the daily maximum of ibuprofen and acetaminophen. And this is why I'm reducing the amount of Tylenol, because you can take a maximum daily dose of acetaminophen that equals 4,000 milligrams, and ibuprofen is 2,400. So we don't want to give them 600 ibuprofen, 1,000 acetaminophen, and then add the Percocet. They're going to overdose on the acetaminophen. So I'm taking away 500 milligrams of acetaminophen and adding it in the back door through the Percocet. So do your math. Remember the maximum dosages: 2,400 for ibuprofen and 4,000 milligrams acetaminophen daily. Okay, do the math and make sure that your patient does not exceed it, because there are some serious risks with that. Again, remember that this formula is fit only if it aligns with your patient's sensitivities, allergies, and overall health. Now, here's something important. If you can help your patient control post-operative pain, post-extraction pain, you're not just a good doctor. You are a superhero in their eyes. You're addressing their fears during and after the extraction, and this is a real game changer that is going to pay dividends. It's going to increase your reputation, it's going to increase your income, it's going to increase the number of 5-star reviews on Google or any platform out there on social media. Because a doctor that controls pain is a good doctor. And hey, I'm not just stopping at teaching you the technical stuff. I'll be sending you an invitation to an exciting new training on extracting broken teeth. So look out for the invitation coming your way, and it's going to end up inside your inbox. This is Dr. Ziv Simon wishing you surgical success, and I'll see you in the training on extracting broken teeth. Take care.